All right, good afternoon. So today I will be presenting an interactive map that connects data and policy in ArcGIS Pro for the 89th Texas Legislative Session. To give some background, I work for the Center for Health Equity, which is a research center in the Department of Epidemiology led by Dr. Sharma. And this is part of a greater service that does real-time monitoring to keep initiatives on track. And so I'm in a room full of researchers. I know I don't need to explain the importance of data, but specifically the context here applies to keeping initiatives on track through key performance indicators. And we do this through two outputs. First, visualizations in Power BI. So when you're on a study, there's different parties involved. And so what we do is we do real-time surveillance and we visualize this data to make sure that our project is going according to its intention. So for example, in food as medicine studies, you want to, of course, make sure recruitment's going well, that the survey completion, and that the patients are actually redeeming the food prescription. And so if an unexpected issue comes up, we're able to pivot quickly so that we can actually keep the project on track. Another output includes interactive maps in ArcGIS Pro. There's a variety of sources we use, and today I'll focus on one that we can use to inform policy. And this includes a team of data scientists, cartographers, and statisticians that help transfer that complex data into the actionable insights, especially when you're in the middle of a study. I encourage you all to scan the QR code to find out more about this service. And then here's our team. On the left is Dr. Sharma, our director. In the middle is Dr. Rampel, who's an expert cartographer and does a lot of the visualizations in ArcGIS Pro. And then I'm on the right. I do a bit of mapping, but primarily a lot of our dashboards in Power BI. So the map that I'm going to present today, before I actually navigate it, I'll explain the sources used. They include two publicly available data sets. The first is the American Community Survey. It's collected annually, and it collects data at the census tract level. It has a variety of different statistics, and the map specifically will include health insurance coverage. As you know, Texas unfortunately has the highest rate of uninsured. And then secondly, the CDC places. So this incorporates data from the Census Bureau, but also visualizes data from the behavioral risk factor surveillance system, and it also offers it at the census tract level. It includes a variety of sources. I've included a bit of them, but it has chronic conditions, preventative practices, disabilities, health-related social needs, health risk behaviors, and overall health status. And then I include the citations below. And this map, you can click on both of them if you're interested in finding out more details about the data collection processes. So what's on this map? So I've already explained we'll have census tract level from the U.S. Census Bureau and CDC places. And here in the central part, the lavender, I include health insurance coverage. So the percent of Texans that don't have health insurance, the percentage that don't have health insurance but have jobs, and then the percentage who do have jobs. We, from the CDC places, we have crude prevalence rates for depression, diabetes, and stroke, and the percent of Texans that report transportation barriers. So this is all available at the census tract level, and you can view them within the House of Representatives and Senators' districts at the state level for this year's legislative session. Okay, and so the map can be accessed by scanning the QR code or this URL, which is tinyurl/texleg89. And so I'll temporarily close this and show you how the map works. Okay, there we go. So bear with me, I'm gonna be navigating from here. So how this map works, it's intended for any user who might be presenting to policymakers. All right, so if you go to the left-hand column includes the legend, and by default, we have the senator's district. The bottom left-hand part explains how to navigate the map. If you scroll down, you'll see the statistics presented. Also, there's a tutorial on YouTube that you can access so that if you want to look at it again, it just gives a 2-minute explanation so you how to navigate it, as well as the statistics presented and the sources used. Of course, the central part includes the maps. And again, by default, we have the senator's district. If I scroll up here, I can toggle and view different layers. Again, you can look at the senator's district. If I click on it, the I with the slash goes over, meaning that it's no longer visible. And I could also look at it by House of Representatives. And then the key statistics are below. For today's demonstration, I'll stick with senators. And then let's say I want to talk about percentage of Texans who have jobs but don't have health insurance. Okay, so I close out here. All right, and then as you see on the left-hand pane now, it includes the senator's district and the percentage range. The darker the orange, the higher percentage of Texans that don't have health insurance but have jobs. Now, this part on the right hand allows us to zoom in to a particular district. Okay, so let's say, so I can look up a district either by the number or the name. I'll do number for today. And let's say I'm talking to Senator Creighton. So I click here, and then the map will zoom in automatically. As you can see, our districts are a bit jagged. And so, but anyway, so as you see, because of the wide geographic reach, the census tract gives us a specific range because there's a lot of different demographics represented, and it gives the policymaker an objective, nonpartisan view of what's going on at a population health level. So let's say I'm talking to Senator Creighton, I can actually click on one of the specific census tracts to get an idea of that percentage. Again, the darker the orange, the higher percentage. So let's say I'm talking to him here and I say, okay, here's your district, Senator. And then in this area, there are 39% of your residents here or constituents are working but don't have health insurance. And again, I can go back to this if I want to, change the or change what's being looked at. So it's hard to navigate from here. But anyways, this is the idea and a gist. And so that is something that we offer here at the Center for Health Equity, is to use this research, but also transfer it into policy, which is a huge lever in all the work that we're doing. And thank you again.